Welcome to the Seatrade Maritime Podcast. I'm Gary Howard, Middle East correspondent at Seatrade Maritime News, and today I'm speaking with Adam Pang from Unimed about developments in the maritime medical space and the new developments in crew health and welfare to predict and prevent health issues at sea. Let's jump straight in. I started by asking Adam to introduce himself.
I'm Adam Pang. I'm currently Chief Revenue Officer of Unimed Maritime Solutions. Previously, I was Chief Commercial Officer of Lloyd's Register One Ocean, one of the largest software ecosystem players in the market.
Great. How can the maritime industry move from reactive medical response that we're used to something more proactive in the health management space?
So I think traditionally, maritime healthcare has been almost entirely reactive. And ships carry medical chests, officers are trained in basic first aid. And when a medical incident occurs, telemedicine services are called in. And that system really works in emergencies, but doesn't really do much to prevent illness or injury before it happens. And I remember a case a few years ago where a fleet noticed repeated gastrointestinal complaints on several vessels. But because each ship was handled in isolation, nobody really connected the dots. Once the data was aggregated fleet-wide, it became clear that a particular provisioning supplier actually had a contamination issue. So early intervention could have prevented several serious cases, and that's exactly the kind of scenario that proactive health management prevents. And what we're seeing now is a real shift towards this proactive health management. And companies are starting to leverage data from medical logs and telemedical consultations, medication usage across fleets. And by analyzing this information collectively, what you're seeing is operators can start spotting patterns. And maybe recurring gastrointestinal issues in a particular region, spikes in fatigue-related incidents, or certain injuries appearing more often on a particular vessel type. The idea is to predict and prevent problems before they escalate. For example, if a trend in minor injuries is noticed across a fleet, it might point to ergonomic or operational issues that can be addressed before it results in serious incidents. I think this approach not only improves crew welfare, but also supports operational resilience by reducing, costly diversions, evacuations, and downtime.
What are the biggest underlying health risks that currently affect seafarers?
There are three categories of risks that stand out. First, you'll find chronic health conditions like cardiovascular disease, diabetes, hypertension, obesity are increasingly common in maritime. Life at sea makes managing these conditions particularly challenging. And irregular shift patterns, long periods away from shore, limited opportunities for exercise, constrained diets contribute to all of these scenarios. Second, there are occupational injuries, which remain persistent. Seafarers perform physically demanding tasks daily, often in really challenging conditions, and this leads to musculoskeletal injuries, slips, falls are very common, and repetitive strain injuries. Third is mental health. It's really a growing concern. And isolation, long contracts, fatigue, and high-pressure environments on board really lead to anxiety, depression, stress-related conditions. And organizations such as the IMO and the ILO have started putting real emphasis on mental well-being, recognizing it's a really critical part of seafarer welfare, and rightly so. And all three categories interact. For example, fatigue can exacerbate both physical injuries and mental health issues, while chronic conditions can increase the risk of acute medical emergencies on board.
Yeah, the mental health side of it is something we see so much reporting on. Seafarers struggling with a lack of shore leave and that sort of thing is a really common thing that comes up in the Seafarers Happiness Index, for instance. What role does telemedicine play in the sort of current modern maritime healthcare?
Well, telemedicine is central to healthcare at sea. You can't just pop down to a local clinic when you're hundreds of miles offshore. Traditionally, telemedical support meant voice consultations or just simple email exchanges. But it's really evolved. Today, it's something far more sophisticated. You have new diagnostic tools, things like portable ultrasound machines, digital stethoscopes, and remote monitoring devices, which allows physicians onshore to get a much more complete clinical picture. And so some systems even allow real-time video consultations, which can help triage cases more accurately and reduce unnecessary evacuations. In one memorable example, we had a crew member develop severe abdominal pain mid-voyage, and using video consultation images from a portable ultrasound device, the onshore doctor diagnosed appendicitis really early, and the vessel diverted in time, and the patient recovered fully. A situation that could have really been quite catastrophic without telemedicine. So this evolution has really transformed telemedicine from a reactive support system into a proactive tool for fleet-wide health management. So shoreside teams can detect trends, they can flag potential risks early, and guide crew with much more confidence in the decisions being made on board.
You've mentioned about detecting trends a few times now. What role should data be playing in improving crew healthcare outcomes?
So data is rapidly becoming the foundation for modern maritime health management. Instead of treating medical incidents as isolated events, we now have the ability to look across fleets and identify trends. So data turns isolated events into actionable insights. For instance, a fleet operator noticed that fatigue-related incidents spiked after crew members worked consecutive night shifts. And by collecting and analyzing data across multiple vessels, they implemented a staggered night schedules that reduced fatigue incidents by almost 40%. Many shipping companies are now just building fleet-wide health dashboards, and these platforms aggregate telemedicine records. They look at incident logs, medication usage, and fatigue reports to complete a picture of crew health. And this allows, again, shoreside-based medical teams to anticipate problems. They can optimize interventions and implement preventative measures. I know one company that started tracking minor pain medication usage recently, and initially it didn't seem significant, but when combined with fatigue reports, it revealed a chronic strain injuries, in particularly in the engine room itself, that could have become really serious about intervention.
If you're enjoying the Seatrade Maritime Podcast, make sure you never miss an episode by subscribing on the app of your choice.
I guess to pick out these trends, you need to have eyes on all of the data that you need, right? How fragmented is maritime health data at the moment?
It's very fragmented. Medical records might be logged on board. You've got telemedicine records that sit with different providers. You've got crew health certificates stored with HR or crewing departments. And you've got medical inventories that are tracked by procurement. So really disparate, siloed data. And the problem is that when data is scattered like this, you can't see the bigger picture, and patterns remain invisible, and decision-making remains reactive. So centralizing these data sets allows companies to move from this kind of siloed scenario to reactive responses to strategic preventive health management across the entire fleet. So in one fleet, they discovered 3 minor illnesses across separate vessels that were actually from the same infection cluster. But because the data was siloed, nobody connected the dots until it became a serious outbreak. Centralizing data would have allowed intervention weeks earlier, preventing the illness and operational disruption.
What predictive indicators are often overlooked in maritime health management?
I think some of the most predictive indicators are actually quite subtle, that are often overlooked signals, right? If you think about the repeated use of pain medication, frequent gastrointestinal complaints, maybe it's recurring minor injuries or increased fatigue, maybe it's rising telemedicine consultations. I think all of these hint at underlying health risks. Individually, each may not seem that critical, but when viewed across multiple voyages or vessels, these patterns really can help predict serious incidents before they occur. And recognizing these small signals early can be the difference between preventing an emergency and responding to one. So I remember a case where repeated headaches and fatigue were logged by several crew members, and onshore analysis revealed heat-related issue in a certain engine room. So really just adjusting ventilation and rotating schedule preventing more serious illness down the line.
Yeah, it's good to have all these examples in here to tie back the data to sort of actions that can be taken to improve the lives of seafarers. You mentioned there about how these small signals can be the difference between an emergency being prevented or having to be responded to. How can maritime health data help to prevent costly medical evacuations, which I guess are getting close to a worst case scenario?
So medical evacuations are really expensive, both in terms of money, but also in terms of operational disruption. By analyzing health data across fleets, companies can spot emerging issues early. For example, repeated cardiovascular complaints or an uptick in gastrointestinal infections in a particular region can trigger preventive interventions. Now, these could include medical checks, telemedicine, monitoring, adjusted work schedules, or targeted wellness initiatives. And early intervention, it not only protects the crew, but can save the company hundreds of thousands of dollars in avoidable diversions and evacuations.
I've had the word gastrointestinal come up a few times in the conversation already, but there's another side to nutrition as well. What role does nutrition play in seafarer health overall?
Nutrition is often overlooked, but it has a huge impact on crew well-being. Poor diets contribute to obesity, diabetes, cardiovascular disease, and fatigue. And at sea, constraints like storage capacity, long voyages, and limited access to fresh foods can make maintaining a healthy diet a real challenge. So investing in better nutrition on board is one of the most cost-effective ways to improve both physical and mental health. It affects energy levels, your alertness, even a crew's resilience to stress, which in turn has operational benefits, right? So one fleet brought in a dietitian to analyze the menus and recommended increased fresh produce and protein distribution. What they found was that energy levels improved and complaints dropped. So it's just small changes can have a huge impact.
Yeah, I suppose it's the case that you might end up spending a little bit more on food, but saving a lot in other areas of the business. We're talking about an overall technological advancement in this space, but are there specific technologies that are emerging to support maritime health management?
Absolutely. And we're really fortunate to be in a period where advancement of this maritime health management is just gaining velocity. Several technologies are transforming how healthcare is delivered at sea. To name just a few in a growing list, you have portable diagnostics equipment like digital stethoscopes, ultrasound devices. You've seen an increase in wearable health monitors for sleep tracking, heart rate tracking activity. We often talk about AI-driven health analytics to detect patterns across fleets. You've got digital inventory management and medication management systems. You've got fully integrated telemedicine platforms now. And you also got compliance data integrated in core health platforms such as drug and alcohol testing. So together, these tools are enabling faster, more accurate diagnosis and proactive interventions and really better fleet-wide oversight.
You touched on two of the most popular letters in the media at the moment, AI just there. How is artificial intelligence influencing maritime healthcare?
AI is likely to be a major enabler of predictive health management. So with thousands and thousands of data points across multiple vessels, I think AI can really identify patterns that humans just might miss. And it can predict emerging health risks, can flag anomalies in medication use. For example, it could flag rising fatigue levels combined with minor injuries to protect high-risk periods, prompting preventive action, particularly when medical indicators exceed safe thresholds. So some fleets are already experimenting with AI-driven early warning systems for illness and fatigue. And these predictive approaches will transform medical response at sea. This means interventions can happen before issues escalate, and it can reduce emergency cases, diversions, and operational disruption.
Yeah, it makes a lot of sense as an application for AI, which is great at dealing with large data sets, right, and determining insights from those. We've spoke a little bit about medical inventory so far. I expect it's quite a difficult thing to get right, to have the right stuff on board and the right number of each thing. How can shipping companies ensure that medical inventories are aligned with the real health needs that there are on board?
Many vessels carry standardized medical chests and is often based on complex regulatory requirements. Without this data, companies really can't tell which medicines are actually being used or which are underutilized. They often have issues managing their compliance requirements, such as tracking medical inventory in highly dynamic environments is really difficult without a system in place. So by analyzing usage trends across fleets, companies can optimize procurement, they can reduce wastage, and ensure that critical medicines are available when needed. This has really key operational benefits, and you have fewer urgent resupplies, and it's just a reduced administrative overhead. Additionally, if you provide services such as telemedicine with access to real-time medical inventory, it would provide a much higher level of situational awareness in cases of emergency. And these tailored responses based on this real-time data exponentially increases the quality of diagnosis and care.
I guess everything we're talking about comes at a price, but what are the sort of hidden costs of poor maritime health management?
Yeah, when we talk about costs, most people immediately think about the obvious expenses, medical evacuations, emergency diversions, and perhaps the occasional treatment ashore. But in reality, the hidden costs can be much larger and far more insidious. Each incident alone seems small, but collectively, they added up to weeks of lost operational efficiency. And then there's crew turnover, right? Poor health management and low attention to well-being can make seafarers feel really quite undervalued. So recruiting and training replacements for vessels isn't cheap. And repeated turnover really can affect morale across the entire fleet. One company tracked a correlation between minor illness reports and early crew departures, for instance. What they realized that investing in wellness program actually saved more on recruitment costs than they were spending on medical supplies. And finally, there's indirect reputational costs, right? How do you measure this? If word spreads that a company doesn't take crew health seriously, it becomes harder to attract quality seafarers. And insurers might charge higher premiums because of perceived risk. So investing in proactive management isn't just about medical costs. It's about protecting productivity, morale, reputation, and long-term operational efficiency.
What barriers are there that prevent the adoption of this sort of data-driven maritime health systems that we're talking about?
I think the barriers are less about technology and more about people, process, and culture. So many shipping companies already have the tools they need. They've got digital records, they've got telemedicine platforms, and some kind of basic monitoring devices. But integrating them across fleets and departments is a major challenge. First is organizational fragmentation. What does that mean? So medical records are on ships, telemedical records are with providers, procurement managers, inventories, and HR holds crew certifications. Bringing all that together requires technology and clear process. So one fleet I know spent months just mapping where all the data existed before they could even begin analyzing it. Second, there is crew adoption. Seafarers are understandably wary of new systems. It feels like they're monitoring or policing, right? So trust has to be built by showing that these systems exist to protect health, not punish or track behavior. And so small pilot programs, clear communication, and training can make a huge difference here. And third, there's cultural resistance at on shoreside offices. Some teams are comfortable reacting to emergencies rather than proactively analyzing data. And I think shifting to a preventative mindset requires leadership to think how they value medical and well-being data. I think seeing it as an operational tool and not just as a compliance requirement. And finally, resource and investment constraints, I think, remain a challenge. Integrating systems, training personnel, and maintaining technology, it does cost money. But the companies that overcome these barriers and really usually see significant return on investment, not just in cost savings, but in safer, more productive and happier crews.
Yeah, and I think we've seen in plenty of other places that correlation between happier crews and better operated ships has been quite firmly established. I guess looking ahead now, how do you see maritime health technology evolving over the next decade or so?
It's just really exciting. I think looking ahead, the next decade is just likely to transform healthcare at sea in ways I think we can just barely imagine today. I think one of the biggest challenges will be integration. Telemedicine, wearables, AI analytics, as I mentioned, diagnostic equipment, and nutrition data. I think will all work together seamlessly. If you imagine a ship where every crew member wears a subtle health monitor that tracks sleep quality, it could track heart rate variability and stress levels. Data feeds into an AI system ashore that can flag emerging trends. Maybe fatigue is spiking across a certain route, or minor injuries in one department, indicating ergonomic issues. Shoreside medical teams can intervene before incidents occur. And we also see advancements in advanced diagnostics on board. You've already seeing portable ultrasound devices, blood analyzers, AI-assisted symptom checkers, allowing near hospital level assessments without leaving the vessel. And satellite connectivity is really improving fast enough to make real-time consultations possible, even in remote oceans. And AI will also bring predictive healthcare. So instead of simply reacting to incidents, algorithms could forecast the likelihood of illness or injury based on crew demographics, environmental conditions, and historical trends. For example, a fleet could anticipate which vessels are at higher risk of heat-related illnesses or gastrointestinal outbreaks months in advance. And finally, I think what we're going to be seeing is wellness and operational integration. So the nutrition programs we spoke about, the fatigue monitoring, the mental health support, will no longer be isolated initiatives. They'll feed directly into the same data ecosystem, helping operators manage human resources as strategically as fuel or cargo.
And then just finally, what does the sort of broader future of crew health and wellness look like in shipping from your point of view?
Well, I hope that the future is one where crew health becomes a core operational priority rather than just a compliance checkbox. And I think we're moving towards fleets where proactive medical management, nutrition, mental health support, digital monitoring are all integrated into daily operations. And I think of it like this, ships will become self-aware about health. We mentioned fatigue trends, we mentioned minor injuries and early health signals, and these will all automatically trigger preventive actions. We mentioned shoreside teams being able to escalate before problems come about, adjusting rotations, providing remote consultations, or implementing targeted wellness initiatives. And ultimately, this means that we'll also see crew empowerment. So these digital tools and health data will allow seafarers to participate in their own well-being, tracking their own sleep, reporting symptoms, and receiving personalized nutrition or fitness guidance. Operationally, what this translates to is fewer medical emergencies, you have less downtime and improved productivity. But it also affects morale and retention. So healthy, supported crews are more engaged, they're safer, and more likely to stay with their employer longer. Ultimately, the goal is a holistic, data-driven approach that combines state-of-the-art technology, human expertise, and preventative strategies. Healthier crews means safer ships, more efficient operations, and a maritime industry that truly values the well-being of its people.
That sounds like a positive outlook to me. Adam, thanks so much for your time and for appearing on the Seatrade Maritime Podcast.
Thanks very much, Gary.
Thank you for listening to the Seatrade Maritime Podcast, and we look forward to joining you on our next episode.